Hello, and welcome to the second webinar in this series about deaf and hard of hearing education in STEM. Tonight, we're going to have a panel discussion and on an exciting topic. We're going to move on to the next slide. First, we want to talk to you participants who are using Zoom. We want to make sure that your Zoom is updated and that you're able to see the panelists and the participants. It's important that the panelists be seen, and that's why everyone is not on screen. You can drag the Zoom to fit your screen so that you can see everyone. If you have any tech issues, the tech support team is standing by to help resolve your issues through the webinar chat box. During our discussions, we will have a Q&A for the audience to view the panelists' answers. We'd also like to get a pulse from the members of the audience and make sure that everyone has a chance to respond. And again, tech support is making sure that they're monitoring the chat box for any assistance needed. So you can type in the Q&A panel for any questions specifically for this panel. We do need to let you know that you need to be using a laptop or a desktop, that it's not, the app is not so functional for this kind of webinar series on the iPad or other laptops. This is also being recorded for later use to show to your students or different people in the community, friends, or others. So it will be seen again and again. It will be posted on CSD website in the future, a week or two after today. Today's topic and the panel discussion will center on deaf and hard of hearing practices in STEM education. The panel consists of deaf and hard of hearing STEM professionals. We'd like to tell you why we're hosting the panel today: to expose deaf youth to role models, adults who are deaf and working in the STEM professions, and to be able to identify with those people in the profession. It's important that we have intergenerational learning, that we share information between the age groups of people, and it benefits young people to have role models to look up to. Exposing STEM and science careers to deaf and hard of hearing youth via those role models. To speak to the panel today, you'll see the pictures on the slide. To the right is the CSD support team. They're working behind the scenes today to make sure that everything works out with the technology we're using for this webinar. So we want to thank them for their support. We couldn't make this happen without them. I am the moderator. My name is Scott Cohen. Scott is my name sign. I'm a PhD student at Gallaudet University and teaching and learning in science. I'd like to give Cindy an opportunity to introduce herself. As was mentioned, my name is Cindy King. This is my name sign. Hello. Cindy, can you tell us a little bit about where you grew up and where you went to college? Yes, I grew up in Alabama in a mainstream educational setting. I went to Gallaudet for 1 year. And at that point, I realized that I wanted to focus more on science careers. And so I changed universities. I got a bachelor's of science in environmental science. And at that time, And that was in Las Cruces, New Mexico, by the way. And I moved to Portland, Oregon, and I went to Portland State University for my master's degree in environmental management and hydrology, which is the study of water. And now I'm in Albuquerque, New Mexico, working for the federal government. The agency I work for is the U.S. Geological Survey, also called the USGS in short. We work with water resources, that's our focus. Okay, I'm turning it over to Alicia. Hello, my name is Alicia Wooten. This is my name sign, Alicia. And I'm from San Antonio, Texas. I was born and raised in San Antonio, and I was in a mainstream school where I was the only deaf child, where I wasn't signing until I was at about the age of 16 when I met some older children who were deaf and I started to learn sign language. I got my undergraduate at RIT, and that was my first experience with science curriculum and courses with interpreters and having access to everything there. I took a year off after that and decided I wanted to come back to science, and I wanted to go to the University of Rochester for 1 year, and I went into the PhD program at Boston University, and I just got my PhD in June. Now I work at Gallaudet University as an assistant professor in the biology department. That's great. Thank you, Alicia. I'd like to turn it over to Andrew. Hello, I'm Andrew Donald. To give you a little bit about my background, I grew up in Alabama. I was there for 2 years, and I moved to I lived somewhere else for 5 years, and then lived in Virginia for 5 years. I went to Kendall School, MSSD, and I was mainstream during high school. I went to RIT for college, and so I've known Alicia since that time. And I was in biomedical science as a major. I was there for 4.5 years, and after I graduated, I took a year off, and I went to work at the National Institutes of Health, and I did dental research there related to the arthritis in the bones, basically called TMJ, and looked at dental prosthetics and the jaw and bone and how you could replace those with prosthetics. I also went to Baltimore, Maryland, where I studied dentistry for 4 years. I'm a general dentist. I am deaf, and I grew up using sign language. ASL is my first language because I have deaf parents and family members. And now I practice general dentistry and have my own business in Maryland. And I have another office opened in Gatlinburg, Maryland as well. I have 2 offices in the state of Maryland, so I'm happy to be here today. Thank you all, and welcome to the panelists, and welcome to the audience as well. We'd really like to take this time to thank CSD Learns for hosting this webinar. We'd also like to thank General Motors for the sponsorship to make this program available. Are you guys ready to start the general discussion? Oh, I see you're excited. Great. So the first topic is, in your experience growing up, how did you get hooked in the STEM and science careers? I'd like to start with you, Alicia. I think everyone expects to be able to identify that moment they fell in love with science, but that was not my experience. I had some things that I enjoyed as a child. I loved dinosaurs, for example, and I wanted to become a paleontologist. And I turned my focus to animals, and I love animals, and I thought I might want to become a vet, and then I went on to thinking about nursing. I always loved science and working with my hands. I wasn't one to sit at a desk and type. I need to be up and doing different activities on a daily basis. And and I just got hooked. It was just in natural, small ways that made me realize STEM was for me. I see. So you developed it as you went along. That's great. Okay, I wanted to make sure you finished your comment. Andrew, would you like to tell us some? I have a little bit of background from my family. I have a medical family. My dad is a surgeon. Um, his brother works there as a nurse, and there are different people that work in the medical field. So I kind of considered being a doctor. And I went to the deaf school, and I remember that there was a deaf staff member there in the classroom. And I was watching them sign, and I noticed their facial expression and wondered why they kind of had their mouth closed while they were using their facial expression. The whole time, they didn't use their mouth at all when they were signing. They just had their mouth firmly closed. In that moment, I realized that teeth affects our self-confidence and how we're able to express ourselves, how we communicate, even in sign language. And expression is very important in sign language, and that was influenced by their dental situation. And also, I noticed that we looked at being able to lip read others was also affected by their dental situation. So I realized that at that time I might want to become a dentist. And after that, I just fell into it. I was all the way in it. I like the theory, the prediction, the results of science, and looking at all those pieces. I also thought, you can apply many of the things in the science field to real life situations. And that's how I got started. And I majored in the career of dental sciences. Cindy, I'd like to give you an opportunity to talk about this. There's no one single moment for me. I noticed there seemed to be different opportunities. I grew up in Southern Alabama near the bayou, and it was a beautiful environment, rich with animals, wildlife, and the environment itself I felt a part of. I felt like we needed to protect the earth for people and animals. And I also just delved into it. Later, I watched a documentary about Jane Goodall, and I was probably 7 or 8 at that time, and I was fascinated. And there was a woman represented on that documentary, and it impressed me. And I'm sure you know of the situation of the oil spill with Exxon Valdez in Alaska. Um, that really affected me. It had an impact on the environment, and it had an impact on the food that people ate, like the fishing industry, and also the animals in that area. And that impacted me. And later, I read a book called Silent Spring, and when I read that, I already knew, I realized I wanted to work in the environmental field. And since that time, for about 5 years, I've focused on hydrology, water resources specifically, and that's where I've been. Thank you all for that. The next question is, how are you influenced as a professional? Who influenced you growing up? And I'd like to start with you. I'm sorry, I wanted to clarify the question. Could you say it again? You talked about how you got into STEM and sciences and how you've learned. But we talked about that, for example. Can you talk about some of who your role models were growing up? So maybe who I looked up to growing up. Okay, sure. Well, it's interesting because I thought I wanted to be a doctor, and I also had an opportunity to see my family life from home and work. So I saw the perspective because the medical professionals in my family, I saw both sides of it. Um, and I wasn't sure that I wanted to work in a hospital setting because there were so many people involved in that. And I thought that dentistry was a perfect fit for me because it was a smaller number of people in the office, and we would get to know each other and be able to communicate together. And the hospital has constant rotating staff, and that wasn't attractive to me. So my family definitely um, had their exposure, the exposure I had to that definitely affected that. And there were, they supported me in dentistry, even though I didn't go into medicine. I went into dental medicine. But my parents believe that anything is possible too, and they supported me no matter what I wanted to do. And they challenged me a lot. They pushed me to get out of my comfort zone. They made sure I had choices, and it was nice that they allowed me to make choices and pushed me to make those choices. As I got older in high school and college and undergrad, I was serious about dentistry, and it was important to start my network because you need to have teachers and parents and other people, friends around you. As an undergrad student, it's really important to have that network. And friends and family were invaluable to me. If I would have pushed away those people who supported me, I think I would have had a different experience. But my experience was challenging as well. I have a good friend of mine who's a dentist and owns his own business as well. And he grew up, he, let me back up. I grew up as that person's patient. They were my dentist. And that dentist signed, and I would be able to go in and have a checkup and get a cleaning in sign language. And as an undergrad, I met many deaf friends who talked about their experience with hearing dentists, and that affected how I thought about that. It impacted me, and that's one of the reasons I wanted to become a dentist. I got more experience. I graduated, and really I was lucky because I had a mentor already in the community, and that was important for me. It helped me quickly improve my skills and be able to develop more competence in the dentistry field. The school taught the foundations, but there are so many things that you need outside of that foundation you get in school. So it was important for me to have a mentor, and there are deaf dentists. There aren't many deaf dentists out there. So I think in whole that should answer your question. Yes, that's great. Alicia said, may I add something? Sure, give us just a second. Okay, Alicia, would you like to go ahead and add it? I want to make sure I had the right name sign for Andrew, but I agree with everything that was said. I emphasize how important it was in my life to grow up I grew up without sign language. So, and I was a big troublemaker in elementary school. I was sent constantly to the principal's office because I had no role models. I didn't have any friends that could talk with me. And I had a lot that I wanted to get off my chest that I didn't have an opportunity to do. The first deaf person I met was a counselor who sat down with me and was patient, and I didn't have anyone in science particularly, but they did reinforce the idea that I could be successful, I could do what I wanted, I could get access to communication to be able to make that change. And without that particular counselor, I would not be here today. I would not have been able to, get my undergrad degree or my PhD. And so the emphasis, even though it wasn't in science, I did have someone to look up to, and having someone in particularly in those fields would be useful. but to know that someone else goes through the same thing is really important. And I know when Andrew and I met each other, it was, kind of out of the blue, and we talked for 2 hours about our mutual experience and understanding. And that was an amazing feeling to know that what I went through was not just an experience that I had, but that others also experienced that. And that, they had people to look up to. And I looked up to Andrew. Oh, I just wanted to jump in there. Okay, thanks for holding. Go ahead. Go ahead, Andrew. Thank you. I wanted to add to that, and I agree with what Alicia said. Not only in STEM, but in the community. That at RIT, my experience was that you had people who were a cohort, maybe in the same program or in the same general area. We supported each other. We were there for each other. Even though the dental program was different curriculum and classes than others, we still had an understanding that the people that in my cohort were going through the same experiences of frustration, and that we weren't alone there. It was a great support system to be able to share with each other. And I'm sorry I've gone on for a while. Let me just go ahead and stop. Thank you very much. I'd like to give Cindy an opportunity to address this question. I didn't have anyone in the science field in my family, but they were encouraging and supportive. They made sure that I, for example, um, had books, opportunities to read and learn, and they encouraged and supported me. They didn't blow off my interest. They did pay attention to that. So I had my family in that situation. There was one teacher, she was hearing, but she graduated, I think, from Gallaudet with her master's degree from Gallaudet, I believe. And she really encouraged me to follow, she encouraged all of us to follow our passion, to follow the thing we were excited about. And those two experiences, my family and the one educator in my life, really made the difference. I see we all have different kinds of people as who supported your journey. The parents and teachers, all of the educators in our life, and the variety of people really do support us. And it's kind of a surprise to see who we can get support from. I look back and I appreciate, our successes and how we've worked together to get to where we are. Andrew, I'd like to add that I agree with what you said. And I want to emphasize the importance of mentorship in every field for any experience. Mentorship is very valuable. You need to know that someone ahead of you has already broke through the barriers. Working in the dental field is really tough. There was only one deaf dentist. And so knowing that they went through that experience made the process and experience easier for me. And I think, Cindy and Alicia both talked about the same, having mentors, having someone, I mean, to encourage the interest that you have in your field and support you through that. It's very important. I agree. I do agree that mentorship is important. Knowing who's experienced what I'm going through and has made it and been successful is a good role model to look up to. Okay, I'm going to wrap up this particular topic. Is there anything else you want to add before we move on to the next one? Anything else about your childhood? In your your childhood in relationship to your STEM and career experiences? Did anyone take AP or science courses? Okay, Alicia, you have something to say about that? I was very passionate about it. I wanted to go to medical school at that time. I wanted to become a cardiologist. So I took 4 years of Latin. I took AP classes, and that really helped me with the terminology during my undergrad. I took AP English, I took AP Calculus, and I did take AP Science as well, biology specifically, but not chemistry. Okay, so biology, yes, but chemistry, no. No, not so much chemistry. Mm-mm. Would either of the other panelists like to add something at this time? I did take AP English, and I not necessarily all the other classes, but there were classes I enjoyed. Marine biology, for example, I was just fascinated with it, and there was a cool teacher, and that made it enjoyable for me. I'd like to see if Andrew had something to add. Alicia and I have such similar experiences. I took Latin to improve my English writing skills. So I grew up confusing ASL and English. I would mix them up and wouldn't be able to discern which was which until I took Latin. And when I took Latin, I understood the structure was different, and that Latin sentences and English sentences were kind of reversed in their structure. And once I understood the fundamentals of Latin, then I got a real hold on English and progressed from there, and it just got better and better. After that, I took um, Italian in RIT, and so there was a comprehensive language experience. My second language is English. Um, I took I took AP English rather to correct, and in high school, I had a moment where I decided, I didn't want to be a dentist, and I kind of diverted from that path for a while. I took business classes, and I love to drive, so I did have some hands-on internship at the Honda dealership, and I learned. There was a Dakota that worked there, and they signed, and that was a really cool access to language. And so it gave me hands-on work, and it helped me decide what I really wanted to do. I had a business internship there as a business major, and I faced a lot of frustration there. It wasn't like my business classes, for example. So I took a biology class at RIT, and I thought, let me just pursue the idea of dentistry again. And then I loved the biology class. And so I switched to biomedicine. And now, um, once I became I became a dentist and went into private practice, I knew. But my high school experience didn't include a lot of science or advanced classes. That's great. Thank you for sharing. Now, some of you have advanced courses in your background, not specifically in science, but in some areas, including science in some of them. Okay, we're going to wrap up this topic and go on to the next slide. Now, I'd like to take a moment to let you talk about your day-to-day work. And I'm going to start with Andrew. I work in private practice. I'm a deaf dentist, and I had a mentor who owned his own practice and mentored me. He grew up oral, and he's comfortable with spoken language, and he can sign as well. But I had a different background. I grew up in a deaf family with deaf parents, so ASL was my first language. So when I saw how it worked with him, and I worked as an assistant, his assistants, hygienist and others were hearing, but they could sign. And I noticed that they all worked as a team together. Sometimes a patient would show up and they would have to ascertain whether the person was deaf or hearing and which kind of communication to use with that patient. And that helped me plan what I would do. So if they were deaf, I would sign. And if they didn't sign, I would have to write on paper with a pen or use a computer screen to type. And sometimes, they would speak their answer and the assistant would sign that answer back to me. But as an assistant, it helped me to kind of know some lines, to ask, are your teeth, just the basics that we already had ready, prepared, like whether or not they had dental pain and were there any sensitive spots? Are they sensitive to cold or hot or heat? So really communication in the environment, has to be adaptable to a case-by-case basis. We can't have, one system that works for every person that walks in the door. So some dental assistants sign, some sign fluently. So there's a need to match that communication style so that we can work together. My everyday life in the office really looks like that. We also have to have agreement with our assistants. If there's a deaf person, we need to make sure that there are 3 of us communicating together. If the patient's hearing and needs someone to speak in the room, there have to be a team to make sure that we can all communicate together and we work together, and that's really important. That's great. Let's move on to Cindy. Okay. As I mentioned before, I work for the federal agency, the USGS, and I'm the only deaf person there. I'm the only deaf person in the Northwest area. And my job specifically is hydrology, working with water. I'm a water technician basically, and I'm out in the field. I go out, I collect water for quality samples, and I collect data related to that. And specifically working with water resources. Around the US, there is no other deaf person in the position I'm in. I have met some deaf employees that work under USGS, the agency I work for, in Virginia near Washington, DC. And, many of them work as admin or IT employees for USGS, but no one works in positions like mine as a hydrologist specifically, or hydrologic technician. So that was a challenge. We had to brainstorm ideas about how we could communicate and improve communication among ourselves. How I could have equal access and improved communication in the office or out in the field. Most of the time I work alone, but sometimes I have a coworker who will go out in the field with me. It just depends on the situation. And it depends on what needs to be improved or fixed or what we're looking at specifically. Most of the time, people are cool and are willing to work with you and agree on different ways to be able to communicate by typing or by email or even writing back and forth. There are many different ways to communicate. Sometimes we use voice to text on our phones, and that seems to work. We have an app for that, and that's another resource. But sometimes I feel as if I feel like most people talk about their projects in incidental ways in the hallway or in the break room. They'll talk about their projects, and others who want to get involved just jump in through that casual communication. And I'm still trying to figure out how to improve communication in those settings and to have access to the same projects like hearing people incidentally do. So that is, one negative about being the only deaf person in the office I work in. So, but most of the time, my job is superior. I love it. I love being out in the field. I do not want to sit in an office all day. That's not conducive to what I want. So, so I love it. So that's my experience in this position in this field. Thank you, Cindy. Andrew, what would you like to say? Cindy, I'm wondering if you work, out of doors most of the time, or are you in an office moving in, doing field studies? Spring and fall, I'm out in the field about 75% of the time. And I'm working with water, looking at waterfalls, lakes, ponds, stream, anywhere where there's water. But in the wintertime, I spend more time in the office. It seems like, I do the opposite kind of work. I do more analysis or reports, make sure that all the data that I've collected has been sent out to the appropriate places. That's where I spend most of the wintertime. That's great. Thank you. Alicia. I'm very fortunate. I work at Gallaudet University. I'm an assistant professor in the biology department. Everyone signs in the community I am in, and it's amazing. And it's a different experience for me. Some days there's no classroom teachers teaching necessary, so I'll sit down and discuss with students and about what their goals are and what they're doing for internship and help them find those internships. Going to class is an incredibly enjoyable experience. We sit in a circle and we talk and communicate about the classroom material. Someday, some days I will meet with students and we'll talk about different ideas. We'll do research, and I'm looking at what my research will be in the future. The interpreter lost the screen momentarily, so I apologize if you weren't able to hear what was going on. We did write notes back and forth to one another. Um, we used someone within the group who was a writer. We had someone to be able to take a look at the notes, and not everyone had access to that. So sometimes we had group text that we used in my, so if I missed something that happened during lecture, someone would answer in the group text. So we had support, and but we had a few issues where people, in the deaf community supported each other. That's great. So that's a great point that you brought up, Andrew. That the point is, learning is an ongoing dialogue. and we have to continue learning. We have to be creative about how we find access in these learning environments. That's a very good point about how we get this information. Cindy, you had something you were saying. I something similar. We use notes. With my supervisor, we have 2 or 3 people. We would copy notes or email them, or and some people were really good at note taking. Others, however, sometimes, if there are 2 or 3 students who are taking notes, then there was less opportunity to miss information if you had several people taking notes. So that is true. hmm But most of the time, it was a very good experience with the other students and the teachers emailing me the information I needed. But sometimes there were gaps, and it wasn't always 100%. But that's part of it. And, that's the reality of the situation we're in. Wow, that was a great additional comment. Thank you for that. We are human and we're not perfect. And the hearing people also have their gaps. So, they balance out. We have one more question before we leave this topic I'd like to add. Can you talk to the audience about, specifically, I think, in each of your fields, what other possible work environments you could work in besides the ones you're currently in? Like Cindy, you're a hydrologist, and Alicia, you're a assistant professor, and Andrew, you're in private practice as a dentist. What other job opportunities are possible out there that people could work in if they had your experience? I'd like to start with you, Alicia. As a PhD student, there are many opportunities. People think that you have to teach in academics only or do research, but there are a lot of other opportunities as well. I still, if you want to do research, you can be involved in industry. You can work with pharmaceutical companies, develop vaccinations or other things. There are a lot of different things you can do with this. Being involved in science doesn't mean that you can only work in the field of science. There's patent law, and a lot of intellectual property is related to new developments and modern technology, like nuclear medicine or other things. So it'd be important to, as things are developed, to patent them. They have to make sure that they're reviewed, researched, and that everything has been documented and patented. And you can work behind the scenes in those medical fields. Public policy is a good place to work if you want to make change to this, science world. Working on policy is a great place to work. Working with senators or others, really, science is not the only place that you can have an impact with your STEM interests. The important thing is to be taught how to think and to be able to apply those things to many different areas, not just your one field. That's great. Thank you. Cindy, would you like to approach this question? With my degree, there are some opportunities to become like K to 12 teaching, but that's not my passion or interest. That's not my preference. Sometimes I might attend by invitation a science fair, or and I enjoy with the children and exposing them to this. Or I work with nonprofit organizations as well that support environmental needs. For example, the Sierra Club and the Nature Conservancy. So there are others nonprofits There are consulting companies that that I could easily work with as well. I'm considering other options. For example, sometimes when I want to take a break from my everyday work, I'll go to another country and volunteer. Like, for an example, 4 years ago, I went to Peru and I stayed for a month in Peru. And I went into the Amazon rainforest, and I worked with one international organization, Fauna Forever, I think is what it was called. And they collect wildlife in the jungle, and you evaluate and observe, the impacts and what the impacts are to the environment and the animals and wildlife in those environments. There are some places where everyone flocks to, but there are other places where there aren't many tourists, and those are places that I like to go to instead of just normal going on normal tourist kind of events. I like to go to the places where there aren't many people and be involved there. And I think that's all. That's great, Cindy. Thank you. Andrew. I have a Doctor of Dental Surgery, DDS degree, and it's the same as a regular DDS, except there's DDS and DMD and MD, and all of them are basically the same things. I think an MD and a DO are similar, but they're different. But my point is that as a dentist, my degree in dentistry or an MD would allow you to work in private business, with the understanding that some states, most states, I think, establish a business owner who owns a dentistry business has to be a dentist. No one else is allowed to own an entity, a dental entity, without being a dentist at the head representing that business. So you could be a business owner, you can work in a hospital as a hospital dentist. Many hospitals have dental clinics. That would be another opportunity. I could be a dental school teacher and teach at the dental school. I could work in a community clinic as well. For example, many of the clinics are government-based. And many of the dentists are facing very large dental student loans, dental school student loans. So one of the ways that they can pay off their loan is to either work as a dentist in the military or work at one of the dental clinics, and that reduces their loans, their student loans. And there's also the opportunity to work in a lab or an office or an insurance company, because they have dental analysts that sit on the insurance company and review information there and have to approve payment or what needs to be covered. For example, if a patient came into our office and needed a crown, then we'd have to talk about why they needed it, whether they had a cracked tooth or whether they had evidence and x-rays and pictures, and we have to document that need. And then we give that need to the insurance company, and they have to review the pictures and other information that's listed in the claim and determine whether or not it's a quality payment and whether or not they'll pay for the crown. And there's an appeals process with the insurance company if they refuse to pay for something. So those are opportunities for dentists as well. And of course, you can work for the government, and I don't have a PhD degree in public health, but we have hygienists and other things that affect health. And so we teach those public health needs So that's another place where our degree could be used. And most of the time, um, dentists have, if there's a high percentage of dentists in private practice or in clinics, I think that's where most of the dentists work. Thank you for that. Okay, we're going to have an audience question at this time, and it comes back to mentorship. If a student is at a hearing college, how can they find a deaf mentor? And must they specifically have a deaf mentor? What's your response? Who wants to go first? Andrew says, I'll go first. I'm happy to go. I'll keep it brief. Like I said, I had a deaf mentor in my field, and I was lucky because I'd already been that dentist patient for many years, so I already had access to that dentist. But there are many other dentists. There are professors that are hearing as well, and you can have communication through a sign language interpreter. And in the dental school, there were teachers there were my mentors as well. They watched my clinical skills. They met with me. They supported me as I was moving forward. They were also my mentors, and they mentored me throughout school. However, I sometimes leaned on my network of friends and other hearing students. It was important that they believed in me and supported me, and that they had gone through the whole procedure. And that's why the deaf mentor was important to me. Alicia. Oh, I'm just going to keep it short and sweet because we're running out of time. But one of the problems that we have today is that, like in graduate school, I couldn't find a role model. I had to depend on friends who were deaf. They were my role models during that time. And there's one unfortunate thing now that deaf and hard of hearing students are we need to be able to grow our future, and we need to become their mentors. So as we're in this field, we need to move forward and do that. One of the challenges we face, I think, is do we work on it? Do we work on the deaf community in the STEM field? And how do we do that? And who do we recruit to do that? Are we looking for someone who works in similar topics, or do we just want someone who's already been through graduate school? It depends on what the student's looking for on how you find those mentors. That's great. Thank you, Alicia. Cindy, did you have anything you'd like to add? I am considering it. My graduate school experience didn't include any deaf mentors as well. I did have one friend who got her degree in forestry, I believe, and she had been through similar experiences in graduate school. It wasn't at the same time, but I was lucky because we were able to meet and connect, and we had a mutual understanding about what the experience was. Because I was the only deaf student in that program, and it was difficult. So it was a challenge. It was a challenge to find a deaf mentor. But with deaf and hard of hearing in STEM, it seems like that field is growing, and I'm happy to see it. Thank you, Cindy. Mentorship can look a lot of different ways. The important is that as a professional, that we come down to their level, even if, or if they cannot find someone who's ahead of them in the field, they can find peers or friends or other people to get support from. We can be mentored in a variety of ways. So we have about 5 minutes left. Let's go to the next slide. our goal is to communicate with classroom teachers about what we can do for deaf and hard of hearing children in STEM education. So, what do you want the takeaway to be? What do they need to feel confident and comfortable in, to know that they can continue in this field? We'll start with Alicia. Okay, so about 12 weeks into working at Gallaudet, I talked to many students from different backgrounds who had different backgrounds and experiences. And one thing that I learned is that we really need to focus on K-12 education. The students need to be encouraged to think critically and be creative. And often in the community, what happens is that the kids will ask a question about what happens, but an adult thinks it's unimportant and doesn't confirm their curiosity. It kills their creative curiosity, and that's so important for STEM fields. We need to encourage their curiosity and encourage them to follow that thought through and understand that that inquiry leads the way into the field. We can't just provide answers. We have to let them figure out how to learn as well. They have to learn for their own through the process of inquiry. And that's really important in the STEM field. So I think that's where we need to focus. That would be the takeaway. And sometimes we forget in our everyday lives, because it's so much easier just to provide the answers or the things they need, but we need them to have a healthy respect for learning, and we need to push them. It's important that we emphasize to children that it's okay to fail, that they should try something and fail, and that failure is normal, and that they can try it again to see what happens until they continue and they have success in the long run as a result of that. That's good, yeah. And Andrew, did you want to add something at this time? I'd like to give Cindy the opportunity first. Okay, great. I agree with what you said. In the mainstream environment, most of the time, I went to classes in the deaf program from elementary school on. And one of the things that I noticed is that teachers in the deaf program were all hearing. They didn't push or challenge us as students. We sat and just received information that was given to us. So we didn't develop critical thinking. And that's the valuable piece that we need to have. Also, we didn't have different methods we could try. Some people have strong hands-on skills, and other people are, highly literate, skilled in reading or English, and there's a variety of skills. So understanding that maybe it's more work for the teachers, but we need to meet the kids where they are and where they're motivated. And the deaf and hard of hearing children can develop successfully in the world if they follow their passion. So I think that's really what we want to encourage them to do. And I'm not sure that they have access. I think access is important. To have access to outside activities, extracurricular activities not in school, like science fairs and activities in after school programs, in different science clubs or other things. I think it's important that they have interpreters or whatever access they need for communication. And I think that applies to parents as well, that not just educators, but that parents need to be motivated to invest in interpreters and request interpreters when needed for science fairs or other projects. going to museums and other things. So, bring the child out into the community with interpreted access. So I think that would be my takeaway. Andrew, did you have something you'd like to add? You have to keep it short. We're running out of time quickly. Absolutely. I agree with everything that was said from Alicia and Cindy's perspective, that we need to allow students to figure it out for themselves. They need to see where their motivation and passion is to be able to continue learning. And also to give them suggestions, have suggestions ready to show students how they can use the resources and have those resources prepared and available to them. So that students, say for example, if they want to become a dentist, they need to know who I am as a dentist. And they could invite me, for example, to meet with their students, and I'd be happy to. Talking with students about what I do and my experience is effective, and I'm happy to do it upon invite. Having hands-on experience is crucial too. Having my experience in the car business was important. Having that internship in the dentist office before was important. And, it gave me an idea for myself to see what I wanted, what fit and what didn't. Having the parents involved is so crucial. My parents were highly invested in working with me, and teachers as well, and friends that I could depend on. And yeah, I think all of that's important. This is great. Thank you all. Thank you all for your comments. I appreciate all the panelists. I feel so inspired by all your comments. And let's go to the next slide quickly. Alicia says, we have a question. Yes, I see that, but we've run out of time for the question. We'll have to answer that question in another mode. I'm sorry. Okay, there's one thing I have learned from teaching at Gallaudet, Alicia said, is I'm focusing on bilingual. I ask students what to do, and I ask them to sign that answer. And then I ask them to put that into English to help them make sure that they can expand on their ideas. So if they focus on that grammar, I want them to be able to, in ASL, to be able to change it to English and not to feel incompetent or demoralized as a result of not having that English skill there. Because when they use sign language, they have all the concepts and are able to express them. And so we let them do that on ASL, and that helps quite a bit. And slowly transition to English. I'm sorry, Andrew, we've run out of time. I know we all have things to add, and thank you. Thank you all for the panelists involved. You see, as we go on to the next webinar, we're looking at January 15th. And after this webinar, we will have a survey to help us see how we can improve. Thank you all for being here. Thank you for watching tonight, and thank all the panelists for their time.